Coral and Reef. I'm just really excited to hear how they're doing, and I feel confident that these guys are really healthy.
Jungle Jenny in the jungle. In the jungle.
Yeah.
All right, let's get them on the scale and check it out. 7.2 pounds.
Good job, Reef.
What a nice present you left us.
It's not diarrhea, but it's not solid, and it's normally solid.
Part of the job, getting pooped on.
I love you.
All right, and Reef is 11.6 pounds. Let's go on in and see Dr. Greek.
Hi, Dr. Reef.
Hi, Jungle Jenny. How's everything today?
Nice shirt. Everything's good.
Thank you. So Reef's been having some soft stool?
He has, like, the last couple days.
Okay.
And so I thought, he just pooped.
Well, that's nice of him.
I know, right?
We'll check them both out. It's been a while since Coral's been in, and with Reef, with the problems we've had in the past, I want to make sure that those are all under control.
Okay.
So we'll do our easy one first. We'll do our healthy curl.
Okay.
So a lot of times when people are coming in for the first time, the big questions that I've got to ask them is all based on husbandry. And because we've been seeing you for a long time, I know that the husbandry is impeccable. But so many of the problems we see with exotics are related to poor husbandry.
What else are we looking for?
When we're doing a physical exam, we start at the nose, work our way all the way down to the tail. What I'm looking for is anything that's abnormal. You look at enough of these guys, you're able to recognize what's normal and what's abnormal. The other is I'm always looking for symmetry. So if I'm never sure, something that's on the right side should be on the left side. So if I see some swelling or anything like that, as long as it's on the other side, there's a chance it's going to be normal.
Makes sense. What about this little spot, like right?
Along the lip there?
Yeah.
It's real common that their lips don't match perfectly.
Okay. So that's totally normal?
It's a very common thing to see.
Okay.
In most cases, doesn't cause any problems. Occasionally, it's like having a fat lip. You may get a little crusty that builds up around there.
Yeah.
In most cases, keeping it clean is all you need to do. Sometimes having some lip balm can also help. Just put a little lip balm on there. Make sure the iguanas have their own lip balm. Her skin's looking great. Her nails are beautiful.
Yeah, thanks.
I'm feeling the abdomen, feeling for any masses or anything else. Her body condition is great. She's not too fat, not too skinny. Nice and full through the hips and through the tail. The skin looks good. Her tail looks good. Her attitude is good. I think we've got a healthy lizard here. All right, big guy, your turn. He had all that swelling in the back of the throat that was actually affecting his breathing. And right now, all that swelling is gone.
Isn't that awesome?
That is incredible. Eyes are bright and clear. Same thing. Good symmetry, no swelling or anything else.
When did they stop shedding?
Well,
Do they ever stop?
They'll always shed. They may not do it as often. They're not growing as much. Technically, reptiles never quit growing. Now, they may slow down to the point where we don't see it, we don't measure it, but their bones never completely stop growing. And you can see on the end of his tail, it's been a year now.
Yeah.
And you can see how much has regenerated. You never know how well they're going to regenerate. Some do a lot, others just small amounts. And it's never the same color. It never has the same scale pattern. This is fantastic.
Isn't that cool?
For an old guy, he's
I
looking
know.
great. Now with his soft stool, stool is a symptom, it's not a disease. So there's lots and lots of things that can cause it. Diet can play a big factor. Depending on what these guys are eating, if they're eating lots of fruit, all the sugars and such will cause loose stool. So any change can throw off their stool sometimes. Now, it can also be signs of more serious problems. It can be signs of bacterial infections. It can be signs of parasite problems. Other more unusual digestive problems with inflammatory bowel diseases or even intestinal cancers and liver problems. So there's a huge list of things that can all cause the exact same symptoms.
So we're going to do a fecal?
We'll run a fecal. If he was kind enough to poop for us.
That's right. Good
we'll
job.
We'll take that sample, look to see if there's any parasites, and then you and I will work out whatever we feel is best for you and for him. Yeah, this is actually looking real good. I'm not seeing any eggs of parasites or anything like that.
Yay!
So, good news.
So, Dr. Reef, Jungle Jenny, and Reef the iguana.
Negative for parasites.
Yay!
So from here, we've got a couple choices.
Okay.
Because there are so many things that can cause loose stool problems, we can do further workup, we can do blood work, we can do x-rays, we can go looking for other problems.
Get a little more aggressive?
Exactly, more aggressive with our diagnostics. On the other hand, we're eating, we're drinking, we're acting normal. Most likely, we're dealing with just something from the food.
Yeah, I think the oranges.
And if that's the case, then let's just play it day by day.
Okay.
You've got my number. If anything changes that you don't like, call, get it back in.
Okay, Dr. Reef. Thanks so much.
My pleasure. Thanks for coming.
I really appreciate it.
Keep up the good work.
Thank you.
Jungle Jack.